In chiropractic, we primarily treat one condition. That's a condition called subluxation. Let me explain it this way. As you know, the brain controls everything in the body, every muscle, every gland, your hormones, your blood pressure, your heart rate, your posture. Everything starts up in the brain. Well, in order for the brain and the body to work together, they have to talk to each other. They do that through your nervous system. The nervous system consists of the brain, the spinal cord, and then the peripheral nerves coming off that spinal cord. Now, the brain sits up inside the skull, sends the spinal cord down through this hole in the base of your skull. Spinal cord then branches off and goes out through these openings. Now, the openings are made up from a notch from two vertebrae. That's to allow for movement and flexibility. Well, what can happen is if a vertebra shifts out of place enough, it can pinch on a nerve. That pinching on a nerve can have a number of effects. Most people tend to think of pain, but your pain nerves are only a small part of the nerves that go through there. Less than 5% of those nerve fibers carry pain sensations. The other 95% go out and control the function of the muscles, control the glands and organs, or carry other sensory information back up in the brain. So you can have significant pressure on a nerve, have a lot of nerve dysfunction, and not necessarily have pain. If it's affecting the sensory part of the nerve, it can show up as pain, numbness, tingling, or burning. If it's a motor nerve going out to a muscle, it can cause the muscle to tense up, be stiff, even go into spasm, or become weak. Either one is a problem. Now, since all the joints in your body are controlled by the muscles are all controlled by the nerves, any dysfunction in the nerves can create problems with the joints and over time can cause damage to those joints. It can also affect the function of the glands and organs of the body. Let's say you have pressure in the nerves in the mid-back going out to your stomach. Well, if the nerve's not working properly, how well do you think the stomach's going to work? Not very well, right? And what most people do is when they start treating the stomach, they change their diet, Pepto-Bismol, antacids. They'll do all kinds of things to treat the stomach, and it may make it feel better. But if the cause of the problem is pressure in the nerves and the spine, you can treat the stomach all you want. It's not going to fix the problem. It's just going to keep reoccurring again and again. So what we look for when we do an examination is to see if there are any misaligned vertebrae causing pressure on the nerves. If there is, that's something chiropractic can help with. If that's not what's causing the problem, if it's something else, then chiropractic really wouldn't be of benefit.